everyone, welcome to my channel. In today's video, I'll be discussing about renal stones. Renal stone, also known as kidney stone, is a common disorder of renal tract. As you might be knowing, renal tract consists of two kidneys, two ureter, a bladder and a urethra. So usually a stone is formed in the kidney, but later due to gravity it can come down to the ureter as well as to the bladder. It is commonly seen in men than women. Now coming to the causes of renal stone, first one is positive family history or a past history. Second one is dehydration. When a person does not drink adequate amount of water, then the waste products is not being flushed from the body. The urine becomes more concentrated, leading to stone formation. Third one is diet. Food rich in salt or calcium rich food can predispose a person to develop calcium stone. Even oxalate rich foods such as spinach, beetroot, tomato, black tea can lead to the formation of calcium oxalate stone. And food rich in animal protein, that is red meat, can form uric acid stone. Also a condition in the body called as gout, where the uric acid levels are increased, can lead to the formation of uric acid stone. And fourth one is any kidney disease can also predispose a person to develop renal stones. Next, coming to the types of stones. There are various types of stones. First one is calcium oxalate. This is the most common type of stone which is formed in the renal tract. Second one is cystine stone. Third one is xanthine stone. Fourth one is uric acid stone. Fifth one is triple phosphate stone. This is the largest stone which is formed in the renal tract. And sixth one is mixed stone. Mixed stone is, as I mentioned the above five, there can be a combination of more than one type of stone in the mixed stones. Next, coming to the size of the stone. So size of stone can vary from a very small size to a larger size. So the symptoms depends on the size of the stone. So size can be small, medium and large. Small is when the size of the stone is less than 4 mm. In such condition, the stone can pass from the body spontaneously by itself. And medium is when the size of the stone is between 4 mm to 6 mm. In such condition, medical intervention is required for the removal of stone. And large is when the size of stone is more than 6 mm. In these conditions, surgical intervention is required. Next, coming to the location of the stone. So first one is kidney. As I've already told that initially the stone is formed in the kidney. So it is also called as stone in the renal pelvis. In such conditions, the symptoms will be pain in the lower back, usually in the kidney region, in the one side, depending on which side there is stone formation in the kidney. So pain can be either in the lower back or along the sides, that is around the hip region. Second one is ureter. In such condition, it can obstruct the ureters. So hence there will be severe excruciating pain. Third one is the stone can be in the bladder. In such conditions, the symptom is usually there will be irritation during some kind of discomfort while passing urine, or increased frequency of urination, or increased urge to pass urine. Such symptoms will be seen. Fourth one is urethra. It is very uncommon to find a stone in the urethra, but it can be there. So the symptom here is there will be pain during urination. Next, coming to the symptoms. So symptoms depend upon the size and the location. But if I have to talk about symptoms in general, then it will be, so in the initial stage, there will not be much symptoms. That is, you can call it as asymptomatic period. And later there will be severe pain depending upon the location. It can be either in the lower back or around the hip region. It can also radiate to the groin region. If the stone is in the ureter, then there will be severe excruciating pain because it obstructs the urinary flow. So severe excruciating pain, and the pain is more on movement or climbing the stairs. The person is restless, he tosses in the bed, no position can give him relief. The patient even draws the legs towards his chest, but still there is no relief. There will be severe sweating, nausea, vomiting can be seen with the pain. And fourth one is there will be blood in the urine. Fifth one is foul smelling urine. So these, and also sixth one is increased frequency or increased urgency, or even the urine quantity can be reduced because of the obstruction. So these are the general symptoms of renal stone. Next, coming to the investigations. First one is blood test. It is to see any if there is any infection in the body. Second one is urine analysis. Third one is renal function test. Fourth one is X-ray. Fifth one is USG. So X-ray and USG will give the detail about the exact location of the stone, and in USG we can also find out the size of the stone. Next, coming to the complication. So if a person has stone, what it can lead to? So first one is it can lead to infection. Second one is it can lead to obstruction. And third one is if the stone remains for a long time, then it can also lead to the formation of chronic kidney disease. Coming to the treatment of renal stone. So as I've said, if it is small, it can go spontaneously, or maybe you need to maintain diet, that is, remain hydrated and also avoid calcium rich food, oxalate rich food, and avoid animal protein. Whereas if it is medium, you have to go for medical intervention. If it is large, you have to go for surgical intervention. Next, coming to the prevention of renal stone. So if a person has a positive family history or positive past history, then he can or he has to follow certain measures in order to prevent from getting renal stones. That is staying hydrated. And next one is diet, having a healthy balanced diet, and avoid more of calcium rich food, oxalate rich food, and animal protein, especially red meat. So by all these, he can prevent himself from getting renal stone. That's it for today's video. I hope this was useful. If it was, do share it with your friends and family. And do remember to subscribe to my channel and start your journey on being healthy. If you have any doubts or any questions, put it in the comment section below. Thanks for watching. I'll see you in the next video. Until then, goodbye.